Okay, so we have Steve Jones here. His date of birth is 3/21/1966. So how are you doing, Steve?
I'm doing alright. How are you?
I'm good. So I'm gonna go over this interview basically, and before we start, how did you find out about us?
My doctor told me to come here.
Your doctor?
Yeah.
Is that your primary care
Yeah.
Okay. And what exactly did you want to accomplish today in our appointment today?
So my doctor told me to come here because I'm having some trouble like hearing when it's really loud and on my phone and like at business meetings.
Okay.
My wife says that the TV's up too loud, but I don't believe her on that one.
Alright. Okay. Do you know when your last hearing exam was?
I don't know that I've had one. When I went to the doctor, they did like a test on me, but they still told me to come here.
Okay, so like a screening. Okay.
I guess.
Okay. How long ago did you notice this decline in your hearing? Is it like this year or a couple years?
It's been getting worse over time, but I'm also like 55, so I didn't think like I would hear the same anyways.
Okay, so like about
maybe like 5 years.
Okay. You've not worn hearing devices before.
No.
Okay. And so when you do use your phone or your cell phone, which ear do you usually use?
So I think my left ear is worse than my right ear.
Okay.
I do struggle a little more, so I try to use my right ear or on speakerphone. I really won't use my left.
Okay. And then just in the last 90 days, have you experienced a sudden hearing loss or just been gradual like you said?
It's just been gradual, yeah.
Have you ever had ear surgery before?
No.
No? Okay. And now I'm going to ask a couple yes and no questions and then maybe follow up on a few of them, okay? So, do you experience any pain or discomfort in your ears?
No.
No? How about any chronic ear infections in the past?
So, when I was younger, I used to get a lot of ear infections, but I haven't had any recently.
Okay. Do you produce a significant amount of wax in your ears?
I don't think so. No? I don't know.
Okay. How about any trauma to the head?
No.
No? Are you experiencing any pressure in your ears at all?
No.
No? And then how about any dizziness?
No.
Okay, do you experience any tinnitus? And when I say that, do you experience any sound in your ears that are unexpected?
Yeah, I do have a buzzing sound in my ears, and it's been happening for the last few years.
Last few years? Okay. And that's in both ears?
Yeah, I think so.
Okay. Do you have a family history of hearing loss at all?
My dad had a hearing loss.
Okay.
He's been wearing his hearing aids for a couple years now.
Okay. Okay, so do you have a history of any of the following? So, do you have a history of cancer at all?
No.
Kidney issues?
No.
Diabetes? Have you had a pacemaker?
No, I haven't.
No? And then how about high blood pressure?
Not for me, but there is a family history.
Okay.
But the doctor said I was fine.
Okay. Frequent headaches at all?
No.
And then is there any other health issues you've had?
Not that I can think of.
No? Okay. Okay, so have you experienced any excessive noise levels in the following situations? So I'll list off a few. How about in your workplace?
Not currently. I used to work construction.
Construction? Okay.
And I didn't wear hearing protection.
No hearing protection?
No.
Okay, and how long did you work at construction?
I probably worked there like 4 or 5 years. I did it while I was going to college.
Okay. So you were younger.
Yeah.
Okay. And then were you in the military at all?
No.
Do you shoot firearms?
I do, yes.
Do you use ear protection for that?
I do now.
No. And then which side do you shoot the gun?
I use my right hand.
Your right hand?
Yeah.
Okay. Do you listen to loud music at all?
No.
No. Do you ride motorcycles?
No.
No. And then how about the lawnmower? Do you use ear protection at all in those situations?
Oh, never when I'm mowing the lawn.
No.
I didn't know you're supposed to do that.
That's pretty common. Okay. And then how is your dexterity? So are you able to use your fingers with small objects pretty
Yeah.
well? Yeah.
I think so.
Okay. So you mentioned your dad had hearing aids. So are there any features of the hearing aid if you do qualify for hearing aids? Is there any feature that you are interested in?
I don't really know too much about the features.
Okay.
My dad's pretty old, so he
Okay.
doesn't have too many
Yep.
features on his.
Okay. Okay. All right, so when it comes to your lifestyle, would you rate it as like a private, quiet, active lifestyle?
I would say we're pretty active.
You're pretty active?
Yeah.
Okay.
Like I'm still at work, and we have a new granddaughter, so there's kids around.
And then, so what are the top 3 environments if you got to pick which top 3 environments, what would you like to hear better in?
In business meetings.
Business meetings?
Yeah. I like to go out and like do things with my friends, like in public places.
Okay.
And it's really noisy and it's hard with the masks and stuff.
So conversations in public.
Yeah, stuff like that. And then I guess my grandkids too.
Okay.
Because I'm just not able to understand their voice.
Right. Okay. All right. So, is there anything else that you think I should know?
No, I don't think so.
No? Okay, well, I think I have everything I need. I may ask a few questions throughout the appointment, but I'm going to go ahead and take a look in your ear and we'll start testing.
Okay, thank you.
Yes, of course. Thank you. Okay. All right. The FDA 8 questions are, so dizziness, if there's any deformity of the outer ear, drainage in the last 90 days, there's a buildup of wax or foreign object, recent onset of unilateral hearing loss in the last 90 days, rapid progressive hearing loss in both ears, bone gap of greater than or equal to 15 decibels at 500, 1000, 2000, and then if there's discomfort or pain. Okay.